Before I had my aneurysm, I was very active. My son was the one that encouraged me to start running again. I was very healthy, never had any health issues. Fast forward a couple of years, I had a brain aneurysm that came out of the blue. I was driving with my husband and my kids. We were house hunting, and I had a really bad headache and waited about 7 to 9 hours because I am a nurse and don't really take myself as a patient. So after my husband talked to my mom, we decided that I should go to the emergency department. And that's where they discovered I had a brain aneurysm. And I had my craniotomy because that was my only option. At first, I didn't want to think that I was going to have any sort of roadblocks because I am the type of person that my family comes first. And I knew that I had to be there for my family. It took a while for me to, say, okay, I need to rest. And, but I came back to work as a nurse 5 weeks after my surgery. My eye was facing the wrong direction for a little while, but I wore an eye patch to try to get it to strengthen the muscles. And as soon as that happened and I was able to drive again, I asked my doctor if I could go back to work. So 5 weeks after my surgery, I was back at ambulatory care center. My son was the one that encouraged me to start running again after we saw a video of the finishers at the New York City Marathon. And I didn't think that we would get into the New York City Marathon because that's a really hard one to get into, but I reached out to the Brain Aneurysm Foundation and they got us in. We ran together the whole time, and it was exciting. It was emotional to see the people there that are out there, that are locals, that are cheering you and have signs, and they're calling your name because we have our name on our shirts. And it was incredible to share that experience with my son. If you have a goal, whether it's a marathon or a 5K, and you can't run the whole thing, you can still, you're crossing a finish line, whether you walk or you run.